Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What are the challenges of practicing medicine in Montgomery County during the COVID-19 pandemic? Find out more right now. This evening is Dr. Annette Pham, a practicing physician and president of the Montgomery County Medical Society. Dr. Pham, welcome to Housecall.
Thank you very much, Dr. Doman, for the invitation and opportunity to speak with you today.
My pleasure. So briefly, before we get to the topic at hand, share with our viewers your professional background.
Yes, as you said, my name is Annette Pham. I'm double board certified in facial plastic surgery and also otolaryngology. My practice is with Metro ENT and facial plastic surgery in Rockville. And we're actually a small division of a larger group, actually the largest group of private practice otolaryngologists, 62 of us in the Mid-Atlantic region, and it's called the Centers for Advanced ENT Care, of which I'm one of the vice chairs.
Very nice, very nice. Briefly share with our viewers who may not know any better, what is the difference between the Montgomery County Medical Society and MedChi, the Maryland State Society?
Great, thank you. So the Montgomery County Medical Society is a local society. So it's actually the component society of MedChi, which is the Maryland State Medical Society. And then certainly, as you know, at the national level, the American Medical Association, the AMA. So we try to work and coordinate at the local, state, and national level to advocate for our patients.
And that's an important role you play then. So given that there's always inherent stress practicing medicine, share with the viewers your take early this year, let's say February, March, when the first worrisome clouds accumulated about COVID-19 hitting not only the USA, but in particular Montgomery County. What was some of the warning you got from the state society and the AMA?
Wow, that's a great question. I think that the issue was that there wasn't as much a coordinated effort from the national level. I think that certainly many of us were sort of hearing some things from the state level and then at the local level, where essentially we would get something from the governor and then from the Maryland Department of Health. And then essentially many of us, larger groups, began to sort of think about what can we do in order to conserve resources. And then collectively, then it came out that, well, we should really just shut everything down and cancel all elective procedures and visits and stuff like that. So I think it was a little bit of piecemeal. I think communication sometimes lags a little bit behind things, but I think that there wasn't that much of a coordinated effort, but I think we sort of got it together just by collectively networking and talking to each other, which is why it was great that, at that time I was really connected with the county society.
When you say not coordinated, are you talking about not coordinated from an AMA standpoint or rather from the federal government?
I think it wasn't as coordinated from the federal government as far as guidelines throughout all the states. I think that certainly if everyone had a similar exact response instead of piecemeal, it may have been a lot more different as far as a response. And we might have been a little bit more proactive rather than reactive. So I think that was the difference.
What is some of the feedback you've received from the membership on a county level or even state level? I know there's been surveys actually held. What are some of the stresses you're hearing about our physician colleagues in the community dealing with COVID-19?
Right. Well, certainly I haven't been privy yet to the survey results at the state level, but certainly at the county level, we did release some survey results from the Montgomery County Medical Society. It was actually sent out to about 1,800 physicians, got about a 5% response, not huge, but I think it was a great sampling across all the different specialties. And certainly when you ask about the different stresses, I think we think about it as a marathon, not a sprint. And there was the early stresses or the early challenges, then sort of the midway, and then certainly some things now. The greatest challenge in the beginning, certainly since everything just stopped to a halt, was just trying to navigate and figure out what we were going to do with all of our routine care patients. And then certainly, just like any business in Montgomery County, physician practices, especially some of the solo practitioners, they were just as hard hit in that they had to shut down. And so some of the financial stresses and burdens of being able to ensure that they're going to be able to continue the practice so that when things opened up, that they'd still be there for their patients as well as for their staff. I think another early challenge was just the simple fact of being able to get proper PPE, personal protective equipment, like masks. From the survey results that we had gotten, 80% of people had trouble getting good masks, good quality, as well as not being cost prohibitive. And then the other thing that was hard to get was gowns. 65% of people couldn't even find any gowns in order to get the proper personal equipment, protective equipment for themselves. So those were some of the highlights. And then, I think that for any one of us, physicians are human and people, and I think just the personal and work stressors were there, social isolation, things like that. I think that there's a lot of feedback with regards to trying to navigate the challenges of what to do with your patients in your practice, and then maybe even on the flip side, your family, what to do now that your kids are your coworkers. So that was probably an interesting challenge.
Some offices I know were really financially hurt very hard with the impact of the pandemic. And I know that there has been some lifelines thrown from the government to try to sustain practices so they don't, frankly, go out of business. One of which was an advance on Medicare funds to help bridge that gap. That was the good news when it was offered last spring. But the way the bill was written, apparently now Medicare is going to be taking back that money beginning in September this month. My understanding is that the AMA is trying to get that turned into a grant, because the timing could not be worse if you're going to be facing another peak of the pandemic at a time when the funds are going to now be taken back by the government. Any word on what's happening there?
I think that's a great, question and ask. I think that some of the details, some of the devil's in the details as far as the different programs that are there. I think you're referring to the one where physicians were able to apply for the Medicare advanced payment. And I wasn't aware that there was a change in what their requirements were, because I think it was always in the application that, they would advance 90 days, and then you would have 120 days after which you would begin billing, and then they would count that towards what you would have been getting paid for. And then thereafter, 7 months period of time, then it would convert into a loan. of sorts. The challenge with that certainly was that the Medicare is obviously for physicians who are par with Medicare, but that basically left all of our pediatrician colleagues, out of that pot. And so I think that was a huge blow.
Are you aware of any practices that have gone bankrupt or simply closing up shop because they simply can't sustain this month after month after month of financial stress?
Right. I don't know of any in particular, except personally, but I know that from the Montgomery County Medical Society survey, one of our questions was, what do you think will happen to your practice in the next 3 to 6 months? And we were very surprised that actually about 65% of the people answering said in the next 3 to 6 months, they would be making some practice changes, which included retirement, early retirement sooner than they had anticipated, selling to private equity, selling to hospitals, and the remainder, 33%, and then there was the other who were unsure. But I think, it speaks volumes to hear that 65% of practices were thinking of making a change in the next 3 to 6 months. And from an anecdotal, standpoint, a close physician colleague of mine who is involved with the urgent care center was very surprised to see that there was many patients who are coming in and seeking care recently because their physicians decided to retire. And I think it's affecting some solo practitioners. So personally, candidly, I don't know any. I don't know the numbers are probably still coming in. But I think that it's definitely changing the dynamics of what's going to happen in the medical landscape now. And that will probably affect patients' access to care, which I'm worried about.
So you think a consequence of this maybe a year from now when things are normalizing will be that access to physicians in general may be reduced?
I do see that. And it may even be longer than a year. It may be several years. I think that the COVID-19 pandemic really has a huge domino effect that we're going to see many changes in the medical landscape, not just because of, physicians who are retiring, but certainly on the other side, we have the students and the residents who were coming out of training, but then may need to delay some of their training because of being able to even practice medicine and finish their internships and residencies because of pandemic itself. And then on the other side, certainly there's workflow challenges. Even if physician practices wanted to open up and see as many patients as they wanted to, there's a lot of measures in place, the social distancing measures, the cleaning of the room. So everything is spaced out, and there certainly are not enough hours in the day to be able to space everybody out. And so I think that there's going to be workflow challenges, and that'll probably impact the number of patients that can be seen. And so it's a difficult math problem.
I want you to hold that thought. We're going to pause briefly for a public service announcement. More with my guest, Dr. Annette Pham, President of the Montgomery County Medical Society. We'll be right back.
Here are AARP's top tips on caregiver preparedness during coronavirus. Form a caregiving team. Inventory essential supplies and medications. Make a plan to stay connected. Maintain self-care and follow CDC guidelines. Learn more on our website.
We're back. My guest this evening is Dr. Annette Pham, a practicing physician and president of the Montgomery County Medical Society. We're discussing the inherent challenges of practicing medicine in Montgomery County during the COVID-19 pandemic. Dr. Pham, when we paused for the break, we were discussing some of the logistical challenges of office hours. Let's expand on that. What are some of the challenges you're hearing from the membership about trying to provide quality patient care during the pandemic?
Well, there's a couple of challenges. There's certainly some challenges on the patient side as far as being able to access appointments because of workflow challenges and trying to social distance patients. I think that many physicians are instituting almost like a virtual waiting room or in their car type of waiting room practice in order to be able to space out patients so that we're able to keep a certain distance for the patients and not having them all congregate around the check-in, process. Certainly, there have been some challenges because patients in general may not necessarily be ready to return for their routine medical care, such as the annual well visits, catching up on childhood immunizations, getting something as simple as their flu shot this year, cancer screenings, things like that. Many of those things have been delayed, and I think that until patients understand that physician practices are doing everything they can to make sure that everything is safe and clean and all the protocols are consistent with the CDC guidelines, because we all attested that if we're going to open up our practice, we attested to the Maryland Department of Health that we were going to adhere to those guidelines. So I think the bottom line is most patients, you should not hesitate to call your physician, today, or text, or go onto the patient portal and really start getting in for your care so that things are not delayed and become too bad, and then we overload any of the urgent or emergency rooms.
You mentioned a moment ago vaccinations. Let's focus it specifically on the flu vaccine. Why is it more important than ever this year that everyone get their flu shot? Share with the viewer the position of the Montgomery County Medical Society.
Right. It's very important. Preventing the flu has always been, important. It's even more critical now when so many of our healthcare resources are being used to treat patients with COVID-19. So certainly by reducing your chances of catching the flu and needing to seek medical treatment for the flu, then patients are doing their part to conserve these already limited resources by getting the flu shot.
You mentioned earlier different ways to interface with doctors. One thing that happily was available and doctors rapidly embraced, including me, was telemedicine. Share with our viewers what exactly is telemedicine and what are its advantages and its limitations.
I'm of the age of certainly learning with the technology. I still know what a typewriter, is and was. So certainly it was a challenge for many of us. Telemedicine can come in many different forms. It is either synchronous, which is an audio and video simultaneous communication with your physician, or it can be asynchronous, where you may be communicating with them via a patient portal, obviously HIPAA compliant, and your privacy is protected. In this fashion, essentially, you're able to access your physician and not necessarily have to be wearing your mask and worrying about the length of time that you may be in close quarters, with someone. And so I think there's many advantages as far as access. There are patients who are not even able to have the public transportation or access that. That's been limited because of the pandemic as well. So I think really the overarching thing is the advantage is the access. Certainly disadvantages include everybody is different with regards to how their savviness with technology is. So there are some challenges there. Some people may not have the proper bandwidth to be able to, connect with their physician. And then, I'm a surgeon, so there's nothing that replaces getting your hands on a patient for a physical exam. And so that certainly is missing. And as an otolaryngologist, there really isn't a way to examine inside the ear or inside your nose. I'm cautiously optimistic we'll continue to sort of develop this, over time. But I got to tell you, telemedicine is here to stay. I think a lot of people were beginning to embrace it and start to do it. But this pandemic has been an accelerant on the fire. And I think
Yeah.
it's here to stay, and I like it.
Yeah, me too. Certainly for many of my patients, of course, my practice is gastroenterology.
Mm.
There is clearly a subset of patients that are adequately served with telemedicine. And
Mhm.
yet there are others when they're, particularly if they're symptomatic, and like you, I need to examine them. Then we say, well, come on into the office. The staff is wearing personal protective equipment, and we'll take every precaution. So
Right.
we mix and match.
Absolutely. And, in medical school, we learned that 80% of the time the diagnosis is made from the history, and so I think that really makes a difference. And now with improving and advocating for telemedicine, MedCai, our state society, has been really advocating to our legislators to keep telemedicine visit payments on par with actual in-office visits, because I think it's been an invaluable resource for many patients, and I think in the long run is going to improve access to care in general.
As you know, with the pandemic, there has been a tremendous economic cost at many levels. One of which has been the Congress trying to working with the Fed to prop up the economy, and that's going to cost a bill of trillions with a capital T, trillions of dollars that has to be paid off over the next few years, understandably. Much to my chagrin, I heard recently that CMS, the federal agency that controls Medicare reimbursement, has announced that in 2021, they will be seeking a 10% reduction in physician fees. How do you think that will fly with the medical community at a time when we're already financially challenged? And as you said, there are accelerated retirements. Do you think that will, as you would use the phrase, add fuel to the fire, accelerate a shrinking medical community?
Right. Well, you just hit the nail on the head. That's exactly it. I don't think that it's going to bode very well for many physicians, and especially many of us who are participating with Medicare. I think what's going to end up happening is, just as you mentioned, is that we'll probably see an outflux of physician practitioners and such, just because of being able to keep up with all of the different financial stresses. And I think the main reason then for us to get organized then and be involved to organize medicine is to be united as a front. And that's why in the beginning we were saying, now more than ever, it's important for us to unite as one under the House of Medicine. So I think it will be a big challenge, and hopefully we'll have more physicians who will see that and advocate and join and become involved.
Sure. Now, of course, the stress is not just for the physician community and the nursing community dealing with patient care, but of course, all of our patients, all of our viewers to variable degrees are facing a great deal of stress, both at home and at work. Inevitably, when you have that sort of escalating stress that is not time limited, has been going on for months and probably soon will be breaking a year, there are spin-off consequences, such as opioid abuse, alcohol abuse. What is the word that the doctors are getting about that escalating crisis?
Well, I mean, that is an underlying issue that we continue to address. That's going on the entire time. Certainly at the state level, MedCai formed a task force 5 years ago, and we're taking a multi-pronged approach to the crisis. So certainly continuing all the initiatives as far as education, prescribing guidelines, substance use disorder screening tools, and trying to really come up with some alternatives to opioid use. So I think that certainly while the public health emergency is occurring and the pandemic is occurring, I think there's many organizations that are still sort of working in parallel to ensure that the opioid crisis continues to be addressed, especially since patients are at home now, and we can sort of then address it via telemedicine, any of the substance abuse sort of needs, things like that. But that's ongoing for sure.
What about the many people who, because of extended restrictions, have been at home for weeks, months on end, and are now facing escalating anxiety and depression? Are there any sort of resources available to help these unfortunate individuals?
There's many resources, and certainly at the county level, there's community clinics. There's a lot of resources that people can access online as well. Certainly, you know that the county health department, under the leadership of Dr. Travis Gales, they continue to communicate updated, accurate, timely information about many resources: COVID, substance abuse, domestic violence. They update that on a daily basis. And, specific to COVID, certainly they can access that on the Montgomery County MD.gov/COVID19, website. And so there's many resources at the county level that I know about that you can get on from the websites. And I think that's what we have now is time. And certainly for patients and substance abuse concerns, I think being able to reach out to therapists and social workers and psychologists and psychiatrists who are offering telemedicine services, I think that offers a great opportunity for them to be able to access that as well.
Are you aware of any data that shows domestic violence has increased during the pandemic?
I don't have any hard data, but certainly there are some reports of that occurring, and it certainly makes some sense, because if everybody is at home, I think that's where these incidents are unfortunately occurring. I know that there's a big push or concern from that, at least for instance from the school level. Trying to also push for some in-person instructional learning so that some of the children who may be unfortunate victims of this can turn to their school counselors and staff, because then they're able to access them in person.
Dr. Pham, thank you for joining us on Housecall.
Great. Thank you very much.
My thanks to Dr. Pham for an excellent interview. My thanks to the team here at the studio for putting together this excellent Zoom meeting. And my thanks to you, the viewer, for joining us. Let us know how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be a fascinating topic. I'll be interviewing Dr. Sharon Spiegel, a well-known clinical psychologist who specializes in hypnosis. And we'll be discussing the role of hypnosis to treat adjunctively both psychiatric issues and general medical issues. It should be a fascinating show. See you then next time for another edition of Housecall. Good evening.